So good afternoon. I'm Jason Holt. I'm delighted to host our two wonderful speakers today, Hilary Gupte and Sunderland, who have worked ever so hard to write this white paper on a very, very important subject, the potential of immersive learning in healthcare. And I'm really, really honoured as Metaverse Learning to really act as a convener, as an ability to share knowledge amongst those stakeholders in further education and in medicine and healthcare, to think collectively around the future of this very important subject. So that is what we are here to do as Metaverse Learning, to convene and to create that community, and hopefully coming out of today some degree of vision and thought leadership around this subject. So I'm going to hand over, before we share our screen, I'm going to hand over to both Hilary and Anne in that order to introduce themselves.
So yeah, thanks very much, Jason, and thanks for the opportunity to get everybody here today. So my name's Hilary Gupte. I have a clinical background in critical care nursing, predominantly clinical education roles. I moved into a corporate nurse role, did a postgraduate certificate in education, and then moved into medical education, where I've been for the last 6 years or so. So I work predominantly in postgraduate, but taking more of a multi-professional focus now in secondary and primary care. And I became a freelance simulation consultant a couple of years ago, which is how I've become fortunate enough to co-author this paper with Anne today. So I'll let Anne introduce herself.
Hi everybody, I'm Anne Sunderland. Like Hilary, I've got a nursing background, so I worked in primary care for a number of years and then went into higher education full-time in 2006, working again primarily with postgraduate courses. 2010, I was bitten by the simulation bug while undertaking a master's in medical education. And then 2018, again, went freelance like Hilary did and work as a consultant in clinical skills and simulation. So I'm also associate lecturer at Sheffield Hallam and Huddersfield University, work with a number of industry partners, and I'm just writing up my doctorate. So EdD focusing on the use of virtual reality simulation in assessment. So that's me in a nutshell.
And Hilary, thank you. We are blessed to have you as both expert practitioners in healthcare, but then, as you say, moving across into the art of the possible with regard to simulation. And thank you ever so much for your time today. And so, just in terms of some ground rules before we kick off with the white paper, you will each receive a link at the end of this with the full white paper. Today is a sort of a summary and also a discussion. If we can leave the Q&A and discussion to the end, but please use the chat to ask questions or make points, and we hopefully can refer to it later. Because we are having Teams issues, if you could keep yourself on mute, but when we are having the discussion, please do come on camera and unmute yourself. And thank you very much. We've now got some slides to share. So if Katie, if you don't mind sharing your screen. Wonderful. And so these slides will be available to all those attending. We have about 150 registrations. We'll have a good turnout today, and this can be shared later on. So if we can move to the next slide, a couple more slides would be great. And the next one. So just before we move on to Anne and Hilary, so in terms of Metaverse Learning, for those who don't know who we are a technology company in the world of extended and mixed reality. So we work in partnership with education partners in anything to do with healthcare, but also engineering and construction, green skills, and our whole motto is around collaboration. So we are the partner that deals with the technology, but our partners are the ones that give us and work in a co-creation model. So everything that we create is in partnership, and our whole ethos is around making sure no learner gets left behind. So it's not necessarily just about virtual reality. It can be accessible through any device, particularly laptop, tablet, etc. So every learner gets the benefit of the power of immersive learning, which Anne and Hilary will talk about. Next slide, please. So we will talk about the white paper through Anne and Hilary, but really the objective of today is for all of you to better understand what immersive learning is in the healthcare world, to discover through case studies that Anne and Hilary will be going through, what's actually happening in practice, and ultimately to get feedback from you through polling and other discussion points as to what you think is the future and what is the best way of employing this technology. Thank you. Next slide, please. Right, over to you, Hilary.
Thanks, Jason. Yes, so I thought I'd just quickly start with defining what immersive technologies are for the people that may not be as familiar. So when we're talking about immersive technologies, we're referring to extended reality, which incorporates augmented, virtual and mixed reality. So augmented reality is where the digital images are overlaid onto the real world, often through apps or 2D screens. Virtual reality immerses the user into a computer-generated world with headsets and often allowing interaction with the virtual environment. And mixed reality encompasses the pair, merging both the real world and the virtual world so that objects can coexist, often with interactive capabilities as well. So all three modes of immersive technology will blur the lines between the real world and virtual world. The next 20 minutes or so, Anne and I want to share the contents of our paper. We want to look at some of the highlights that we picked out, open up the discussion with you guys in the audience about what the future expectations may look like in our sphere, and also make use of Metaverse Learning bringing us all together today, because we have a lot of rich insights in the room, and we'd love to share some ideas with you guys as well. So as Jason said, with a few of you on the call, if you can save your questions for the end or pop them in the chat, there's a little team behind the scenes that may be able to respond to your questions in the chat. Otherwise, they can pull those out at the end and share them with us. So our paper is quite generic about the evolving needs of our sector and how immersive technologies can be embedded across a multitude of curriculums. So hopefully there's something everybody can relate to within the webinar and the paper. And I want to start with some of the drivers for immersive technology, whether you've experienced them or not. There's a huge surge in the use of tech, and COVID-19 has had a massive impact on that as well. I want to share some of the pros and cons of immersive technology and offer some solutions to the challenges that we might be faced with when we're trying to integrate it into the curriculum. And our paper and the webinar promotes a blended learning approach. I'll then hand over to Anne, who's going to share some of the case studies that feature in the paper. And I believe some of the faculty involved are also in the audience today and may well be happy to answer questions if you've got any specifics. Anne's then going to offer some practical guidance and key recommendations when integrating immersive technologies into your curriculum. And then we want to propose what we think the future of... Oh, hello, sorry. We want to propose what we think the future of health and social care education may look like with the rapid developments and accessibility of technology. So hopefully this is a useful webinar, and we'll whet your appetite to download the paper afterwards as well. So Katie, if we can go on to the next slide. First of all, I just want to do a little poll really to see who in the room is already using immersive technologies within their organisation, who you're using it with, so which professions, and what level of training are using it as well. So hopefully you will all be able to interact with the poll that should pop up in the chat in a minute, and we can see who is using what where. So I think there's a chat coming up. If you can't respond because you're an external member or for whatever reason, please do pop it in the chat as well, because we'd love to know.
We have
There's a nice mixture coming up there. I think you should all be able to see the results in the chat as well, and that may continue populating as we go.
Yeah, we have about 60% so far responding.
Excellent, fantastic. I'll leave that going and we can feed into that at the end as well. So if I can go on to the next slide, please, Katie. So immersive learning has been practiced in our sector for years because it provides our learners with the safe space to practice scenarios that either they're not going to experience in real life until they need to, or just for a purpose of deliberate practice or mastery learning. There's always going to be a growing trend for technology enhanced learning. In addition to the rapid advances in technology, there has been a big drive in the popularity of immersive environments recently. The COVID pandemic then became a catalyst because we needed to find innovative ways to continue providing immersive learning within the strict regulations of the pandemic. And I personally found there was a lot less faculty available to teach. With so many restrictions in place, there became a backlog of education to catch up on. And this, I suppose, is where immersive technology started appealing to me as both resourceful and scalable. We also know that the more it's used, the more accessible it's becoming. So the more third parties that are supporting our sector is going to make it easier for us to get engaged with it. In terms of further education, Metaverse Learning and Anne and I collaborated at a really exciting time, but a very prominent time in our landscape because it's changing so much with the knock-on effect of the pandemic. So more people are applying to join the health and social care sector, which is fantastic. More people means more training and more clinical placements are needed. But sadly, in healthcare, we're shorter staffed than we've ever been before. And it's becoming increasingly difficult to accommodate placements, and it will do as the years move on as well. So also in the UK, we've got some of the highest requirements of practical experience in undergraduate programmes that's required. And these challenges are recognised by some of the regulatory bodies who have increased the number of hours that this can be practised in a simulated environment. So great that immersive technologies can therefore provide some of the appropriate solutions to bridge this gap between theory and practice with a blended learning approach to keep patient safety at the forefront of what we're doing. So if we can have the next slide, please, Katie. I wanted to highlight just some of the documented benefits, and I'll give you a minute to read this screen. These are some of the benefits that have come out and much more detailed in our white paper. The blue ones are probably things that you already know about immersive technology benefits if you're working in that scope. The lilac are some of the non-technical elements. The yellow are additional benefits, which I personally wasn't as aware of until I started working in the field. The orange relate to faculty benefits and sort of adult learning pedagogy. The teal are related to assessments with immersive technology, which is becoming more utilised and more researched. And the pink is more of sort of the art of the possible and where the future might be heading with this. So I'll just give you a minute to have a look at those. This may generate some questions or some thoughts as well to feed into the discussion later. So some of the benefits that really resonated with me is the enhanced realism. And that's where we can provide immersive experiences with a real-time physiological change, or with multiple patients in the same scenario at the same time, without having to reset simulation rooms. So moulage is fantastic. There's some brilliant high-fidelity mannequins on the market, but we can have much more realistic bleeding and enhance real-time problem-solving and critical thinking for learners through immersive technology. Another benefit that I picked up on was the active engagement. So all participants are able to experience the scenarios from a first person perspective rather than assuming observer roles. And I've seen this benefit coming into play massively during the debriefing phase, where everybody really engages with the discussion and brings their own emotions and empathy into the discussion as well. And we know as educators that if we can evoke emotions in our learning, we can make the learning more memorable. And the third benefit that I really believe in is the immersive learning allows scenarios to be used by larger groups of students, either simultaneously or replicated across wider cohorts, but by providing the same learning experience for everybody. So 3 benefits that I found really useful. Companies like Metaverse are currently developing all sorts of content tailored specifically to our sector with the aim of developing and delivering the full benefits that you can see on the screen today. So if we can move on to the next slide, please, Katie. So alongside the benefits, there are challenges, and I think it's important we know what these challenges are ahead of time in order to try and minimise and mitigate them. So within the paper, we've offered the challenges, but we've also offered some solutions to try and help people start their journey to embed it within their curriculum. So motion sickness is probably the one that comes into people's mind first of all. And it generally isn't a concern in education. The research that's done is predominantly in fast-paced gaming research. And if you're using sort of virtual reality headsets for less than 15-20 minutes, then it's rarely a problem. And most technologies also, as Jason said earlier, can be offered in a 2D format as well. So if it is an issue, it's easily mitigated. Another concern people have got is the development time and the costs associated with immersive technology, which it has been an issue. I definitely feel it's less of an issue now, and there's more companies supporting our sector. So the more that they support it, the more accessible it becomes to us. The equipment is easier to access, and the external companies are developing packages for our peers, which means there will be some off-the-shelf content available or some subscriptions that make it possibly a more time-effective and cost-effective way to get started. I would point out that using a third party that already understands the sector can also help hugely in reducing the costs and the development time. In terms of infrastructure, so again, a lot of technology requires access to specific organisational networks, so early collaboration with IT support will massively help. There's also a lot of solutions on the market that no longer require access to networks, so that could be of huge benefit for the likes of paramedics working in the field doing scenarios where there is not an internet access available. And then finally, faculty development and onboarding can be seen as a challenge, but as with any new technology that you're introducing into the curriculum, there's always going to be an element of onboarding your faculty. Organisations like NHS England and ASPE are already supporting faculty development programmes that incorporate immersive technologies. So we're definitely getting there, and there's more coming out as we speak. I'm going to hand over to Anne, who's going to have a look at some of the case studies that feature in our white paper as well.
Thanks very much, Hilary. So, Katie, if we can move on to the next slide, please. Oh, thank you. Okay, so what we're going to do now is just share 4 case studies with you, just to look at the different ways that immersive learning's been integrated, how that's been done, again, touch on some of the challenges, some of the pros and the cons, and some of the learning points.
Can you see?
Sorry. Are we okay?
As the screen having some connectivity issues here. Great.
The slides appears okay from this end, so hopefully everybody else can view that. Thank you.
We're having fun here in HQ. Over to you,
oh, the slides have gone again. The slides have disappeared again. So I'll just wait for that to reappear. There we go. So if we start off with Sheffield Hallam University as the first case study. So Sheffield Hallam University has a large cohort of undergraduate nurses, and as Hilary alluded to, when the pandemic hit, along with that came the challenges of trying to utilise placements, accessibility. Lockdown added to that and caused, again, more problems going forward. Also with the pandemic, there was increased need for qualified staff to be on the ground. So that added impetus really to help support third-year nursing students achieve the skills and the practice hours that were needed to make sure they were fit for practice at the end of their registration. So Sheffield Hallam University purchased a number of licenses from an established VR company with the view to using those licenses to allow third-year students to access certain scenarios that were integrated into the curriculum quite quickly because of the need to do that, but they were linked very closely with theoretical components of the course, but focused on the practical, the clinical element of that. So third-year nursing students would undertake training online and then go away and access these scenarios individually and work through those at speed. Also, the benefit of using an established platform, there was integrated feedback incorporated into that platform already. So as soon as a learner had worked through a scenario, they got instant feedback, which aided as far as reflection on action goes and working through those scenarios while things were still fresh in the memories. Looking at the analytics from these scenarios and how the third year students progressed. you could actually track the number of hours in simulation that were undertaken. So that allowed things to be easier as far as meeting the Nursing and Midwifery Council hours for simulated practice placement goes. It also allowed faculty to unpick the process that the learners went through, so the order that they went through things within the virtual scenarios. And the outcomes demonstrated that clinical reasoning skills were enhanced, communication skills were enhanced as well, and also, obviously, with using virtual reality, the need for the number of faculty was reduced. Once onboarding had taken place and students were familiar with the platform, less faculty hours were needed to actually run the simulation-based learning. So it was thought that there would be some reduction in staffing costs because of the integration with simulation-based education. But what came as a surprise is that there was actually a 74% saving when it came to faculty hours and use of estates, so that, you know, no rooms were required. Students could access this at home on their computers, or come into university where that was appropriate and use the virtual reality headsets. So there was a huge return on investment as far as cost goes, and it did allow those student nurses to meet their learning outcomes and to qualify at the relevant time, therefore going into practice to help the burden that began obviously when lockdown hit. So Sheffield Hallam scenario, again, there's links to the full report within the white paper, so you can go and have a look and have a read and look at some of the outcomes in more detail. If I move on to the second case study, and that's Calderdale College. Calderdale College are one of the country's largest providers of further education and apprenticeships, and were one of the first organisations to deliver T-level education. And for those of you that might not be that familiar with T-level education, it wasn't familiar to me when I first got involved in the project. It's a 2-year programme that's equivalent to 3 A-levels, but within that there's a component of industry placements, so it can be seen as a precursor perhaps to going on to higher education and accessing nursing courses, for example. So Calderdale College was successful in applying for funding through NCFE's assessment fund, and basically looked at developing 3 bespoke scenarios that would encompass some of the care certificate standards, primarily looking at infection control and embedding that within these scenarios. So the scenarios were first of all developed within the IRIS platform, which some of you might be familiar with. So IRIS is an online platform that helps you to write scenarios, develop scenarios, but has inbuilt standards within that. So all the industry standards, such as INACSL, Association for Simulated Practice in Healthcare, are integral to the process. So the outcome of that scenario being written in the platform is that it meets industry standards. So the scenarios were written within the IRIS programme, and then they were actually delivered in 2 modes. They were delivered in one of the local hospitals in their simulation suite, but also were developed as VR scenarios. And one of the key things of the project is that students were actually involved in delivering and developing the VR aspects. So those students that were undertaking IT courses were involved in developing the scenarios. Industry partners were involved, as there was no in-house skills to develop the VR components. And then students practiced, were onboarded with the platform prior to undertaking the scenarios for assessment. The key outlines for our key benefits from the project highlighted certainly the need for faculty development. The scenarios that were developed that were actually delivered within a hospital setup were supported by experienced technicians. VR, on the other hand, was new to the college. The scenarios were developed from scratch, so they were new to the faculty as well as the students. So that was a bit of a challenge. So it did highlight the need for planned faculty development prior to delivering virtual reality. It also highlighted the need for organisational structure and for that to be in place to support the integration of immersive simulation. So making sure Wi-Fi signals were strong enough, making sure that the IT department and the faculty had the resources to be able to troubleshoot for students if that was a need. That was also highlighted. And one thing that was a little bit of a surprise, but that was really useful to learn from the project, is that virtual reality scenarios were preferred by neurodiverse learners. So even though it was a relatively small cohort, it did support the notion that virtual reality was an added bonus, an easier way for neurodiverse learners to actually learn and learn quite deeply from the experience. Also, again, some of the outcomes from the project highlighted the need for pre-planned, apologies for that, pre-planned like pre-briefs. So making sure that we're clear links to the undergraduate curriculum as far as the scenarios go, and also the debriefs following the scenarios. So we'd expect there to be an emphasis on that anyway, because that's where most of the deep learning actually takes place. Towards the end of the project, we did record a short video which gives you some insights into from the people concerned, and also shows you little clips from the scenarios that were developed in VR. So Katie, fingers crossed that technology won't let us down. Shall we see if we can just have a look at this short video?
What could possibly go well, Anne? Okay.
Right. Bear with me because I have it.
We are in action. Just a second.
Here we go.
We initially came in to help the students understand how VR projects are put together, how we plan them, how we execute them, and how they're delivered. And we were able to give them some expertise from the industry. It was very interesting working with the students, and it was very interesting to see how fast they picked it up.
Working with these key strategic partners that has really allowed our staff and students to innovate and develop new skills. And we're delighted to be one of the first providers to use virtual reality in teaching and learning, but for assessment purposes.
Students have been coming to us for training, so they get to use the mannequins. The mannequins are full-bodied mannequins that react like a real person. After all these students are our future workforce, so came along and had a little look at what we had to offer.
Using virtual reality for assessment purposes rather than learning as such, it's a first, and even higher education are just beginning to think about using these processes. So I think Colesdale certainly at the forerunners of what the future is going to look like.
This is probably the best example I've seen of using immersive learning in an FE setting. The students coming through FEs are a key part of the workforce. This is just the first step in their career, so that whether they go on into placement, into working in an organisation, or going on to then higher studies, what they do here sets them up for that journey, really, and helps take them forward.
Okay, thanks Katie. So short message there, just highlighting some of the people that were involved in the project. I think one of the key benefits from that project as well is that it was a real collaborative effort. The University of Huddersfield evaluated the programme. We had industry partners that were included all the way along the journey throughout developing the project brief prior to getting the funding, right through to developing a paper at the end. So that was one of the key benefits. It was hugely collaborative. I believe we've got Rebecca Weeks in the audience, who is the project lead for the Colesdale project. So if we do have any questions towards the end, hopefully Rebecca can help us answer those if there are any queries. I'm just going to hand back to Jason now to talk us through the next case study, if that's okay.
Thank you, Anne. Thank you, Hilary. So far, it's been absolutely fascinating. As you say, seeing that case study from Colesdale really brings it to life. So in terms of bringing this subject to life as well, so through Metaverse Learning, we have, and Hilary mentioned, a sort of off-the-shelf content. So of course, anyone in delivery of education can create their own content, but actually resources may not allow for that. So what we have at Metaverse Learning is a library of content that's licensable to providers wherever they might be, which they host on their LMSs. So if I just share my screen and just give you a little taste. So we've got a hopefully you've got sight of my screen. Katie, is that sharing? Fantastic. So in relation to Cambria, I don't know if you are on this line, but hopefully you can answer any questions yourself. So Cambria being an example of a college that have licensed our material. So for example, in healthcare, and I noticed that the major attendees on this call are carers. So this was a set of simulations developed in partnership with about 12 different institutions, including NCFE and actually majority of Welsh colleges, interestingly enough. So if I just give an illustration of what we do here. So our partners tell us what are the pinch points in terms of delivery that are difficult to replicate, rare situations that actually you want to go through as a simulation rather than a reality. So in this case, the scenario which you can navigate, interact with just through your keyboard or Zoom keys on your tablet or phone is around treating Mr. Hospital. And as you go through a sequence of steps, whether it is putting on PPE, whether it is assessing Mr. Hill in bed 9 with what could be the problem, you are going through all those different aspects that are, to Hilary's earlier point, bridging the theory with the practice, getting muscle memory in there, making mistakes with no consequence, so making mistakes safely, and everything that the learner is doing is done is being recorded on the LMS, so rich data coming from it. So it's getting used to taking temperatures, taking blood pressure, all sorts of different measurements, which you are then in a very immersive. This is a show reel, so actually you're not hearing the sound, but the sound is one of being in a hospital ward, and so it's extremely. You feel the pressure of what it would be like in that scenario, but the beauty of a simulation. If I forward this scenario gets to a point at the end where you get to see your final score, I just get to, here we go. So I've got a pretty awful carer, it would seem, 31%, but crucially, I can learn from my mistakes. You can see, you can interrogate where you've gone wrong, understand the right answer, then go back and do it again. And a lot of so in Cambria, for example, learners were absolutely loving this and doing this probably in advance of their actual course material, because they were so eager to find out levels, levels 1, 2, and 3, and these are all mapped to qualifications. This is another example. So this is caring for somebody in their home. Again, it's a scenario which is very hard. You wouldn't want to do this as a learner for real, and so this is every step from accessing a home of a patient who in this particular case has Parkinson's. And if we talked about communication skills, Hilary talked about practicing those. So you are communicating with the patient, you don't know where they are. Again, this is a snippet, the patient's collapsed on the floor, and you need to go through in a very pressurized situation, the sequence of events that ultimately you were then trained for, God forbid, in the real scenario where you actually are doing this for real. So, what you do first, you'd actually check that you are safe as the carer, making sure that you are not in danger from a gas leak and so forth. So you're determining the cause of, and again, as you forward the scenario and you get to the end, and there you are, slightly better than the scenario, 56%, and again you can interrogate your mistakes. So in terms of case studies, we have about 70% of the FE market are contracting with us with various different programs that we've created in partnership with them. And as I say, it's sort of easy plug-in. Stop there and hand you back to Anne and Hilary.
I think it's back to Hilary now for the next case study.
Yeah, so I was involved in assisting with delivering a postgraduate curriculum for doctors, which focused on human factors and non-technical skills. And it was designed and delivered to Yorkshire and Humber trainees. There was about 100 trainees within the academic year, and we offered an immersive experience, which we filmed 180-degree video footage and played through VR headsets. So it made the learners feel a sense of presence within the scenario. And the course consisted of 4 scenarios, but the USP, unique selling point for this, is that it was filmed and edited by the faculty themselves. So we did all the filming, we got actors in, and we did it ourselves, and we streamed it through VR headsets. So I'll let you have a quick look at the footage, and then I'll share with you some of our outcomes of what we found were good. And yeah, share that footage if that's all right, Katie.
Absolutely fine.
We always like a bit of anticipation.
Hi, yeah. Could you come see Bert Reynolds for me? He's come in from home this morning through A&E with query urosepsis. Paramedics said his house was filthy and really cluttered, and his wife's been having difficulties at home with him most days recently. He is febrile, he's hypertensive, his news is 6, but 3 of that is from a new onset of confusion. He's got some IV antibiotics for urosepsis, but he's pulled his cannula out. He's not keen for me to haven't put another one in just yet. And he wants to go home, but I need him to be seen really. So if you don't mind seeing him, and let me know whether you want me to persevere with the cannula or whether he's going home. Thank you.
Oh, come on. I need to get home.
Go home.
No, I can't stay here. I'm wasting time here. Go on, I need to get home.
Well, I think the doctor should see you
Right.
first.
You're here. What have you got to say for yourself?
I'm really, really worried about him. He's been getting more and more confused, maybe over the last year or so. I can't get him to see the doctor. I wouldn't say he refuses, but every time I try and bring it up, he just dismisses it. And that's been getting worse for the last couple of months, I would say. He's really muddled, really confused. He's been having accidents. Yesterday, he had an accident. I tried to get him into the bathroom to get him changed and everything, and he got really aggressive. And he pushed me, and I nearly fell down the stairs. So that he's never done that before. That really worried me. I was frightened for myself as well as for him.
And you're worried that he might do something again, or?
Yes, I am. And then if he hasn't got me, then what happens?
So what was nice about this is that it shows the dialogue between the nurse and the wife, and highlights a bit of a safeguarding concern for her as well. But when this is viewed through virtual reality headsets, you feel like you're in the ward with the patient and his wife, and it makes it much more powerful than watching this in 2D. Bert Reynolds, the patient in the background, you could observe his behaviour, you could hear the noises he was making, you could hear noises from other patients. I think at one point in the scenario, another patient in the bed next to him starts talking as well. But it was much easier to pick up the verbal and the non-verbal cues from both the patient and his wife when you're immersed in the same space as them. So it gives you that heightened sense of presence and leads to a bit more of a comprehensive understanding of the whole situation. What we found from doing this pilot project was that the trainees had achieved a deeper reflection than with previous simulation sessions that tried to achieve the same thing. The immersive technology triggered senior trainees to draw on lived examples from their own practice, which was very different when we tried it with junior trainees as well, but it was really nice, and it really changed the dynamics of the debrief. Within the debrief as well, trainees appeared to express more emotions readily than they did with traditional simulation, and we're not sure what that's down to, whether they've evoked more emotions for them than when they observed scenarios in the past, or whether because we had less faculty, it felt more comfortable to express some emotions. So this was definitely a scalable, resourceful solution for the medical trainees. It required less faculty, and it certainly wasn't inferior. If anything, it was superior to the traditional simulation that we were previously delivering. Before I hand back to Anne, there is a question in the chat about learners not being adaptive to the headsets. And that obviously that's a concern. And we found with this project that most of the trainees coming had never put on a virtual reality headset before, but they were very quick to adapt to it. We set the scenario up and played it for them, but even when we talked them through how to set the scenario up themselves, they picked it up quite easily and they were able to do that. There is a train of thought that people are becoming digital natives, so sort of as the gaming generation come through into further education and undergraduate training, they may be more familiar with it. But I think it's really important, just answering your question, that we stick to a really generic onboarding to avoid sort of the stigma of people that may not have ever experienced gaming or virtual reality headsets, sort of from a poverty deprivation perspective as well, just to make sure it's really generic. So I'm going to hand back to Anne now to look at some of the rest of the paper.
Thanks, Hilary. If we can move on to the next slide, Katie, please. Thank you. So on this slide here, what we've tried to summarise are some of the lessons that we've learned, both from our personal experience being immersed into the VR realm in education, points from the case studies as well, but also looking back at the literature. So you'll see in the full white paper that we did do quite an extensive literature review. So this is hopefully pulling through 6 points to take forward if you're thinking about implementing not just VR simulation, but basically any simulation into your curriculum. The first thing is to think about what platform is going to best meet your needs. So it depends on what the drivers are for you to want to implement simulation further into your curriculum. It might be that something needs to happen rapidly. If you've got a huge influx of new students and you need to be able to scale at speed, then it might be that buying something off the shelf is going to be appropriate to your needs, as long as the contents meet the learning outcomes for the course that you're delivering. It might be that you want to develop bespoke simulated scenarios, and you may or may not have the skills in-house to do that. So here it might be that you could work maybe collaboratively with industry to look at how you can develop something that's more specific to your requirements, but it's utilising external or potentially internal resources to do that. As we have already alluded to, the second point there thinks about the environment. So the structure within your organisation, is that already able to support more technology enhanced learning? Is your Wi-Fi signal dodgy in certain buildings? I know that happens for a number of organisations. Are there enough staff there to be able to support potential troubleshooting, both for faculty and for students? So looking at the wider environment, I think, is key. Again, faculty development, point 3, we talked about that already, but really it's not just focusing on using the new hardware or software that you might be using, but it's thinking more holistically about the wider pedagogy of simulation-based education. So that might be signposting faculty members to NHS England's online simulation development platform. It might be developing your own in-house train the trainer courses, for example. And there are lots of other courses already in existence that you can tap into as far as faculty development goes. I think historically, I don't know whether people would agree, but often simulation has been used as a bit of a bolt-on to an existing curriculum. It might be, coming towards the end of a financial year, you've bought a new piece of kit, we're going to use simulation, let's add it into what's already in existence. But the key to success, I think, is embedding that simulation into the curriculum, mapping it against the learning outcomes and making sure that it ticks the boxes as far as the transfer from theory to practice goes. And using it as part of a blended learning approach, so making sure that the links between theory and practice are very evident to the learner, and that will help support buy-in as well, and use of the VR scenarios. Again, we've already alluded to the standards of best practice. So that's thinking about the Association for Simulated Practice in Healthcare standards. It might be others such as INAXL or Society for Simulation in Healthcare, but building in those standards into your simulated scenarios, regardless of whether they are ones that you've built bespokely for your own organisation, or looking at, if you've bought an off-the-shelf package, how have these standards of best practice being integrated into those. So making sure that you do work towards standards of best practice is key. And then the last point there is evaluation and reflection. So really important to gather data from both your learners and faculty around how are these scenarios working? Are there any changes? What about changes to clinical guidelines? If they've come along, have the simulated scenarios been updated to reflect that? And also, as technology advances, it may be that tweaks to the scenarios and the way that they're run and developed and integrated might need to be changed. So just 6 points there to think about as far as implementation goes. If we quickly move on to the next slide and think about the future of immersive simulation.
I'm just going to interrupt there, and we might want to give a chance for Q&A. So if we can wrap up fairly quickly to open it up, because we've only got 10 minutes left to slightly overrun, but thank you.
I'll speed it up, no problems. So the future direction of immersive simulation in healthcare, again, we've just pulled 4 points here to consider. So there is already, looking at the evidence out there, an increased use across all healthcare disciplines, and certainly with FE colleges coming on board with simulation, that sort of shows that. There's a growing trend for use in patient education as well, so VR can be used particularly in rehabilitation, but also in educating patients on like pre-admission. So there was an example in Hull where a VR platform was utilised for midwifery, so it allowed patients who would be going in to deliver to become familiar with their environment before they were admitted. Hilary's already alluded to a greater use of mixed reality, so again the literature is supporting that, and there's also evidence now to support the use of increased roles for VR within assessment, both formative and summative assessment going forward. We can move on to the next slide. Thanks very much, Katie. So just really to sum up the key recommendations, I think the first thing is to embrace digital literacy. It's not going to go away, so make the most of it. Embrace the changes and the new technology changes coming forward. Think about your blended learning approach. So how are your simulated experiences built into the curriculum, and ensuring that it's the key learning outcomes that are driving that integration rather than a new piece of kit that's come along. Think about the use of mobile technology as well. So can your platform be utilised on mobile phones, for example? And how might artificial intelligence be incorporated into what you're already delivering? With the use of simulation, we're moving a little bit away from human interaction. So we don't want to use those skills. So focus some of the scenarios around communication skills, so those are not lost and they're still enhanced. Consider simulation for assessment. So that would both be for summative learning and for formative assessment as well. And think about implementing your simulated scenarios on a staged approach. So, you know, think small to start off with, maybe focus on one cohort of students, one module. Start small, make sure your faculty and your students and the organisation are comfortable with using that technology and implementing it into the programme. And then if you do look at the evidence within the literature, it's quite evident that simulation is an acceptable and effective method of interactive educational delivery, and it does highlight that it dovetails with most learning style preferences, so it's appropriate for the majority of students. Just going to pause there. If we can move on to the next slide, we've got a couple of poll questions, so I'll hand back to Hilary for this component just to get you thinking a little bit, and then I'll pick up on the last 2 questions in a moment.
Yeah, so I think we'd like to have gone through these first 2 questions, actually. If there's anything in particular that you want to just pop in the chat as a burning question, we'll try and answer that for you. I'm just conscious of the time. But if there's any particular topics that you'd like to see within immersive technologies that you think need more research or more evidence behind them, please just pop them in and we can have a look at that and see what the market need really. But otherwise, any questions in the chat we can try and answer.
Thanks, Hilary.
Thank you.
For the last 2 questions there, they're just really points to get you thinking. So again, it might be because we're short of time that you just put your suggestions in the chat. But what are your thoughts basically on the increased use of immersive sim and how that might affect communication skills? We've alluded to that briefly, but what are your thoughts? And also, how do you think that the increased use of immersive simulation might change the role of educators? So again, if I can just ask you to put your thoughts in the chat, that would be really useful, and we can pick up on those towards the end. So at that point, I'll hand back to Jason.
Thank you so much, and Hilary. What a treat to hear your pearls of wisdom and experience coming from a clinical background and then moving into the education side. And it's been an absolute treat to hear real hard evidence why this is a potential game change for the sector. I'd like to invite any questions if you are. We've only got, unfortunately, 5 minutes left. We'd like to have left more, so please do make any points you'd like to raise in the chat. But if you got anything urgent, there's time for 1 or 2 questions from you if you want to come on screen and introduce yourselves. Dean, please go ahead. Dean Walker.
Hi there. Yeah, thank you. I appreciate that. Thank you for that. I don't know whether it's urgent, but I certainly thought it'd sort of bridge the conversation. So, and I've just sort of wanted to reiterate as well. Thank you to Hilary and Anne for what is a really big piece of work as well. And I guess certainly it's really nice to see through the conversations that you're having that the key principles and values of simulation are being protected, which is really difficult to do when you start to bring in immersive technologies. So, really great to see that. I guess the only thing I wanted to ask, I guess, from your guys' point of view, working in a higher education institute myself, we're starting to find some challenge with regards to, I guess, the buy-in from faculty and students with regards to the replication of clinical placement hours. And I appreciate we've already touched on this ever so slightly. I guess, is there anything that you guys have managed in your own areas really to support that buy-in effectively? I guess is my question.
I think that's a really good question. It's a difficult one, isn't it, when you're trying to simulate practice placement learning. I think the key thing that I would suggest, and you've probably already done this, is to have a look at the literature out there. Obviously, everybody's struggling with placements. There's a lot more of published evidence now to support its use. And I think it's highlighting that benefit to your faculty to try and get that buy-in that way. So it's basing it on evidence that's already out there, but focusing on things like, there isn't a reduction in communication skills, for example. So things that they might be worried about, I would, have a look at the literature and point out that, points have been proven and it does work.
Yeah, amazing. Thank you.
Thank you, Dee. Sorry, Hilary, go ahead.
I was going to say, just answering a question from Alex in the chat, in terms of verbal speech recognition, there is a lot of AI coming into immersive technology now, and that is particularly something I'm really excited about, what the future will look like with that. So yes, it is on its way. I can't reply to chats, I'm afraid, but I can speak.
Brilliant. I think there's a time for 1 more question. Any further questions? There are lots and lots of points in the chat, and I suppose in terms of my observations for you, Hilary and Anne, some major sort of wows in terms of neurodiverse learners preferring immersive learning. There's a 70% saving in terms of costs, in terms of faculty savings, the accessibility issue. I mean, what, maybe in a minute each, just what are your thoughts around the future of immersive learning in healthcare generally? How do you see it rolling out?
So I personally, as I said, really looking forward to the AI element and how that's going to be integrated. The project I was involved in was not interactive, so that's definitely something that I think is going to be a huge benefit for non-technical skills, and also to avoid any sort of communication losing concerns that Anne's already alluded to.
Yeah, I think, I mean, it's crystal ball gazing really into it. I think what I find most interesting is looking at new technology that might come along that we're not aware of already. So a bit about, we're not aware of the unknown, basically, what's going to come along and how exciting and what challenges we might be faced with in the future. Technology develops at such a rapid pace. Who knows what's going to be around the corner? And I think that's one of the exciting things to consider.
Absolutely. But what I'm hearing from both of you is that even what we have today is very, very effective. And I believe that for me, the lesson is working in this sort of knowledge share way, the fact that you are prepared to give your time, and Hilary, and share something that is so important to any provider, any college, any university, in terms of how they might rethink how they deliver and assess formatively and summatively their learners is really important. So hopefully all of you today have learned something. There is now a link to the white paper. We will also send it separately for those who couldn't attend, but if you zap that QR code, you will see the full white paper that Anne and Hilary have spent lots of time and energy and thought into creating for the benefit of all of you, for the sector, for the future of healthcare. Thank you so much to both of you. Needless to say, we are here to answer any of your questions as Metaverse Learning. We ourselves are creating more and more content. We would love to hear from you what that might look like. So please do get in touch with me or my colleagues if you are thinking of any particular areas that you would like support on. But in the meantime, Hilary, and thank you ever so much.
Thank you, Jason, for the opportunity. And I think there's some of the questions we'd love to have time to answer, but you can contact both of us on LinkedIn if there's anything specific you'd like us to try and address for you.
Thank you. Thank you. And there is a feedback QR code. If you could give us feedback on today, that would be ever so helpful for future white paper launches. Many thanks to all of you. Have a good rest of the day. Bye for now.
Thanks, everybody.
Thanks. Bye-bye.
Bye.